Hey guys, I thought I would do a really quick video. I kind of told you guys I would update on what's going on with Parker and try to explain a little bit more when I had some time and when I knew a little bit more. Unfortunately, I don't know a whole lot more, but I'll just let you know what's going on right now and where we're at, and yeah. So I'm going to try to attach a video at the end of this one to kind of show you Parker's walk. I did put it on Facebook. It's sorry, I'm like sitting on the toilet. It's closed, but it's the big boys are playing a game, so it's noisy out there, and Jackson's sleeping, so I'm in the bathroom. Oh, sorry, I'm trying to like be fidgety and get in place. Anywho, I'm gonna try to attach that video. What it is, this is how we normally walk, right? Well, he walks really inward on the insides of his feet. And my older brother and my dad always did that too, and my younger brother does too. So I never really thought anything of it, but it started getting more and more extreme. And he started complaining of leg pain, hip pain, knee pain, ankle pain, muscle pain, and that's not normal. And he started complaining of, like, he said it feels like there's bugs crawling on his feet when he stands up. And his feet will go numb to the point where he has to sit down and wiggle his feet around, which I don't think that's normal for an 8-year-old either. I don't think that's really normal for anyone, but particularly not an 8-year-old. Sorry, my hair is just bothering me. It's like, ugh. Anyway, so I kind of mentally noted it in my mind, and Parker does have Spina Biffida Occulta, which isn't really anything to be concerned about. It's a birth defect at the base of the spine. It's one of the vertebrae. I think it can affect like up to 3. I'm not 100% sure, but spina bifida that you are probably familiar with, it's open all the way through to the spine. Parker's occulta means closed, so there is skin there. And most people that have this don't even know they have it. That's how like non-important it even is. But sometimes it can cause issues, which is what I was thinking was going on possibly. And a doctor back in Iowa also thought the same thing. But we did know he had it since he was a baby, and I was changing his diaper one day and I noticed a really big dimple at the base of his spine, and that's how we found out. So anyway, it got to the point where I was like, okay, it's time to make a doctor's appointment to kind of see what's going on, and his ankles will give out on him and he'll stumble a little bit here and there, and I'm just like, I'm just not comfortable with whatever's going on. There's something going on and we should get seen finally. So I took him to the regular pediatrician, and the pediatrician had him lay on the table. Right off the bat said, I don't think it's anything to do with spina bifida. It wouldn't cause this or something like that, which kind of put me off a little bit, that he wasn't even going to check it or whatever. Anyway, so he had him lay on a table and was like moving his feet and his hips, different range of motions. And what I noticed is, okay, let's pretend he's laying on his back. Like, I'm on my back and these are my feet, and he bends his feet towards each other, and this is kind of where they naturally should stop, but his one just kept going until it was pointing at the ground, and he said his hip was really loose. So he wanted to do hip x-rays, and I convinced him to do a lower spine x-ray too. Just, I don't know, I thought maybe it should be done. So he said okay, he'll do that. So we went and got x-rays that same day, and the test results came in 2 days later saying that there was nothing wrong with the hips. He didn't mention anything about his spine or anything. I have no idea. But he said everything looks normal and good. So he can't find a cause for the hip problem or the knee problem or the ankle problem or the walking problem. So he said there doesn't really need to be any follow-up. Just kind of keep an eye on it and give him ibuprofen for pain. Well, I wasn't comfortable with doing nothing. And if I'm going to be giving my child something for pain, especially every single day, because he's in pain every single time he walks or stands, I think we should be trying to figure out what causes the pain and not just how to treat the pain. You get what I'm saying? And so what I told him is, well, it was his office staff. The doctor never did call me. It was the office staff or someone or a medical assistant or somebody called me. So I told her, I said, well, tell him that we want a referral somewhere else to maybe an orthopedist or a neurologist. I don't know. I'm not a doctor. I don't know where he would go for this kind of thing. But I did say something needs to be done because I'm just not comfortable letting my 8-year-old be in pain without knowing what the pain is coming from, right? So I also said if he refuses to do any follow-up care, then he will no longer see my kids as patients of his. So that's kind of where I left it. I'm not really happy with it at all. And we did get a call back, not from him, again from a medical assistant or an office staff or something like that, saying that he let us have a referral to an orthopedist. So that's where we're going, and I have already found a new pediatrician that we are going to switch to because I had some problems with this pediatrician with Jackson and his head banging and all that kind of stuff too. So that was pretty much the last straw for me, and I want a doctor who's going to listen to my concerns and not just brush me off, because quite frankly my kids rarely go to the doctor, so if they're going for something that's causing them pain, it's probably something we should look into. And if I get to the point where I feel that they should go, I don't tend to overreact too much on stuff, so I think it's something that I should be validated and listened to, that, yep, okay, maybe there is something going on, let's just check. So I don't necessarily think it's something totally serious or anything, but there is something going on and we need to get to the bottom of it. So I'm going to keep advocating for the best healthcare that my son deserves. So that's what we're doing. And I don't know when the specialist appointment is going to be because the pediatrician's office has yet to call me back. I'm hoping by Monday I'll get a phone call and figure out how long of a wait it's going to be. I know with Trevor, he had to go to a developmentalist, and it was an 8-month-long waiting list. That was when he got diagnosed with autism. So this is something different. So I don't know if it's going to be like we'll get in quickly, or if we have to wait for months again. Hopefully not. But anyway, I'm going to go ahead and add that video to the end of this one of Parker's walk. And yeah, talk to you guys soon. Bye.